Dr. Becky here at Premier Chiropractic. I get asked a lot of questions about why we're adjusting during pregnancy and kind of what to expect, so I want to give you an idea with this video here. But one thing you can expect, and a lot of mothers just love, is that you can lie face down on the table when you come in. I have this special table here. It lifts up as much as you need, and then I can go down here depending on how far along you are. So whether you're newly pregnant or you're 39 weeks and about ready to go into labor, we can adjust the table height there for your belly to sit comfortably in, and then you can lay on your back while I do the treatment. What I specifically am looking for is symmetry in your pelvis when you first come in. We want your hips and everything to just be totally symmetrical, because what happens is your pelvis should be sitting like this, right? And a lot of times we have a torque on one side or really tight in the sacral area on one side more than the other. It kind of gives constriction throughout the abdomen here. So if we're torqued here and this is moving here, ligaments and everything are constricted. So I work at completely balancing and making sure that is symmetrical. It really comes in handy as far as pain goes, and then it just, not being constricted on one side gives the baby a little bit more room to move, and it really comes in handy when you are ready to go into labor. So just making sure everything is symmetrical in that area. Women also ask, will this affect my baby? When you are in our office, I am working on and treating you, the mother. We're looking at your body, your structure. After you've had baby, we can certainly see baby, but I'm not doing anything specifically to affect baby. Now, when I am working in your hip area, you might get a little bit more relief or less pressure in one area, which can help. But again, the midwife and the OB are specific to see the baby. I am treating you in the office. The next question I get is, how often do I need to come in when I'm pregnant? What can I kind of expect? And that varies for so many women. So when you first come in, I'm going to check you out. We're going to do a full evaluation and go over everything that you are experiencing, maybe some past things, things like that. So totally depend where your spine health is right now when you first come in. So some women can come in, randomly get adjusted throughout their pregnancy when they're kind of feeling it, and then others need to come a little bit more frequently depending on the level of care. I do give exercises, so the first time that you're coming in, we're going to go through exercises and do those over throughout your treatments to kind of hold the adjustment, to make sure we are stabilizing and keeping these muscles in shape while you're pregnant, just to help in labor and pregnancy and everything. And then I also do some of this rock tape here. This one is nice and pink. I have black for those that don't want to support or do the hot pink, but just I put it underneath the belly and up to kind of support. It almost acts like a belt, a pregnancy belt that you wear, but instead of you having this tight thing over everything, it supports in the specific areas that you need, as well as your low back, to kind of relieve pressure. When we're pregnant, we have a lot of pressure going on here and kind of throughout the ligaments, so it just relieves that pressure. If you have any other questions, if you want to call to schedule your appointment, I know there's a link below that you can do that, and we look forward to seeing you in our office.